Hey everybody, Dr. Roseann here. And I don't have a lot of guests. So when they're a guest, it's very special. Right? So
Good.
you meet people in life that you respect and love, and then you meet people who have other neurodivergent kids. And the Hartmans have neurodivergent kids. And so the Hartmans and the Hodges love to get together. But most importantly, Dr. Hartman is a medical doctor. He is just a genius and an absolute detective. And I think one of the favorite things that I love about Dr. Hartman is he believes that everybody can get better. He never gives up on you. He's constantly digging and digging and digging. And his expertise isn't just to identify root causes. It's really to dig in there, connect them, and teach people how to change those root causes. And as things are changing in the world, Dr. Hartman is just like me. We're complex case kind of people. And I would love for people to learn a little bit about you, your family, what brought you to this work, and tell us a little bit about it, because we all take different journeys to get here.
Yeah, thanks a lot for that intro. I'm really super excited to be here because we've spent a lot of time talking about a lot of cool things. And how did I get down this path of seeing these complex cases? It actually started with my family. My wife, Becky, is a pediatric occupational therapist, and her specialty was kids with special needs. And so our daughter Anna was one of her patients who we brought into our home because her foster home was closing. And our first interaction with the healthcare system in regards to Anna was the GI doctor said, "Hey, she's small. She's itty bitty. Let's cut a hole in her stomach and put a feeding tube in so we can pour sugar water called formula into her belly and fatten her up." And talking with my wife, even though she was never supposed to walk or talk, we knew that she was going to do that. And crawling is an important part of that. And if you have a feeding tube, you can't crawl. She was never supposed to talk, but we knew that eating food and chewing, swallowing was a part of that. So we just realized this small intervention could radically change her trajectory. So we opted out of it. We learned two things from that experience. The first one is that the gastroenterologist reported us to Child Protective Services for child abuse and neglect because we didn't follow their instructions. And we worked through that, but I learned early on that the system doesn't like it when you push back on them. They like people and patients and parents to do exactly as they say. And we also learned something else 6 months later, when my wife found a growth chart for kids with CP. My daughter has cerebral palsy, and Anna was in the middle. She was normal. So the specialist did not know this chart existed. So the second thing I learned is that the system doesn't like you to push back. And the second thing was maybe the specialists just don't know. And all of a sudden that lit a fire in my belly, like, oh my gosh, like I have to be the expert for my daughter. I have to be the person that questions the specialist. And so that was like the ancient Cape Canaveral that was a mile at the moon that became Richmond Integrated Functional Medicine, that became a whole new brand, became all these things, but stemmed out of that of my daughter Anna, our family, and that we got Abigail, we got Khalil, and each one of them has their own unique story about their health that we had to navigate, and it became the fire in my belly that was informed by my education that became Richmond Integrated Functional Medicine, which is what I do today. I take care of my spiel. I take care of people who have been to multiple doctors and multiple specialists that have either been told they can't be helped, there's nothing wrong with them, or worse off, it's all in their head. And there's people come and see me, and now I connect the dots that are blocking their body's ability to self-heal and repair and let their body do what it was made to do. And that all stemmed out of how we formed our family, actually. So,
Yeah. And, I think, I talk all the time about a third of my people who come to see me actually are medical doctors or pharmacists, right? And multiple of them have had Child Protective Services reported on them, and they're in shock, right? But you are 100% right. I mean, you push back on the system and they don't like it. And, and it creates such a fear in people that is legitimate, but also, when something's going on with your kid, you need to push back. And, you really took it to the next level to change everything that you're doing so that your own kids could get well. And you've been so committed to that. And what a scary thing in the world to know that your child you can have government agencies and to really then dig further that they didn't actually know. And I think we go to specialists and we think that they know, but they don't, right?
Yeah, I mean, they have, they know this much about this much. They know a little bit, super crazy deep, but the human body is this, I refer to it as a 3D spider web. It's an interconnected network of interconnectedness. And so in that world, you need an uber generalist, not specialist. You need your plumber, your pipe fitter, your welder. You need your architect. You need all your people to help your building, right? But ultimately, you need a really good GC, someone who could actually do the floor work if they need to do it, someone who could actually do the AC if they needed to do it. But their specialty is how all these things interconnect. If you don't do it the right way, your house gets mold in it. It's not conditioned right. Your floor is off gas, and the building falls apart. Like if you don't have the right foundation built. And so, really, yes, we need specialists. I know patients. My son, got his when he was 8, got his head crushed in an elevator. We had to go to the local medical university to get evaluated for a head injury. We needed that acute care. But after we knew that he was going to be okay, the 95% nerve damage on his face, he came back home and we worked on it. And doing functional medicine is what got the nerve to heal. So I think these work together. And there's times when you need that uber specialist at the university to do stuff. But 90% of everything is outpatient clinical medicine. And we need more of these people who can connect the dots and figure out what's going on with
Who are
patients.
willing to connect the dots, right?
That's an important caveat as well. They have to be willing to connect the dots. And
Yeah.
willing to, I've got 3 board certifications. I'm still learning now. We were talking about this before. It's like I'm reading a textbook. I've got it propping up the computer here of actually it's a Prescription for a Healthy House. It's a great book about it's my light reading right now. I'm learning about how the building affects your health. And this is just every couple of months I got a new textbook I'm reading,
Well, you said something before we got on, and it's true. And people always ask, I'm sure they ask you, the same question. How is it that we're different? Like, what is it that we do, right? And one, we are willing to connect the dots, but we are always learning every single day.
Yeah.
Like I have my alerts, my research alerts set up. So I'm always looking at the research. I listen to books. I don't have time to read. And I drive a lot in the car. I won't give up driving my youngest back and forth to school because it's a special time and I have him captive and he'll have great conversations with me. So that means I drive a lot. So I listen to books on tape. It's a great thing. But don't you feel that that's the missing secret sauce? And besides the willingness, it's the being current, helping to understand, why is this happening? It doesn't mean, your kid's unfocused, that it's ADD, or that you had a head injury, that is the actual thing. But what did it trigger, right? What happened in the body? Why can't you recover?
I think there's a lack of natural, innate intellectual curiosity. We have an educational system that's like you go through, middle school to high school to college, college to medical school to specialty. And once you get out, you've arrived, you got your board certification, you can stop studying. All you do is maintain your certificate. And so, for my board certification, I need to maintain about 150 credit hours every 3 years. I read that much information every 3 to 4 months. So literally I could read for 3 months and stop my CME for 3 years. And that's our current system. And that's great for the average person, but I just have this natural curiosity. And so I think part of it is like someone who has a natural curiosity. But also another way I look at it is there's this learning curve. People forget it takes about 20 to 30 years for clinical research to make it to standard of care. Hand washing, Ignaz Semmelweis, he invented hand washing. It took 20, 30 years for that to catch on in Europe. And how was he rewarded for his discovery? He lost his career. He was jailed for insanity because who would accuse German physicians that were dirty? And part of his punishment was you beat the crazy out of people. So he literally got beaten in jail, got a staph infection, died from what he was trying to prevent. Smoking in our country. It took 50 years and 7,000 research articles before the Surgeon General of the United States said smoking causes cancer. So people forget that it's a big time lag between finding evidence and the actual implementation. And so I tend to think we're just the tip of the spear. And with things like mold and hypermobility, I kind of joke, we're at the compressed air at the tip of the spear. So it's one of those things where if you're there, you're automatically going to be 20 to 30 years above the curve. I mean, I was talking to you, interviewing you for my podcast, before this conversation, and you're saying during your training, you were going down to the microfiche in the library you're training and reading about diet and nutrition being related to mental health and the environment. And no one was talking about that, but the literature was there in microfiche. Yeah, I forgot about those things, about microfiche that you were learning and you were applying early on to your career. And just now, 30 some years later, is it now something people talk about?
So many people are talking about it.
So, yeah.
So, we're root cause specialists, right? And I say we really are, we are very much aligned, right? We're yin and yang. You're coming from the medical part, but you're also always looking at the nervous system. I am a nervous system dysregulation specialist, and I'm always looking at the medical part, right? So we can have geeky conversations all day long because we're both really committed people who are always learning and always changing what we're doing to be better. But in many of our people, neuroinflammation is a huge part of mental health. It's one of the biggest reasons people come to me. And I want to talk about two areas of expertise, right? Yes, you address, infections. Yes, you do all that. But I really want to talk to you about hypermobility. And then I also want to talk to you about mold. And mold is a really like a conversation du jour. Like people really are talking about it. Nobody talks about hypermobility. And you and I say almost all of our peeps got hypermobility, and they don't understand how this is part of that web, how this is part of what is holding people back. So talk about what is hypermobility and explain what happens and why this can be a healing blocker.
Well, there actually is a thing called the pentad super syndrome. In the literature, that's a thing people can look about. And what it is 5 things that if you see one, you always look for the other 5. Hypermobility, mast cell activation, okay, GI tract issues, including IBS and inflammatory bowel problems, dysautonomia and POTS, and autoimmune diseases. So all of a sudden, if you see any of those, do you see any of those, Dr. Rowe? Of course you do.
All day long.
That's your jam, right? Then all of a sudden you have to look for the other one. The one of those 5 that no one talks about is the hypermobility. And so I think about hypermobility as the superpower that becomes kryptonite. We're watching the Olympics right now. We're recording this. We just finished watching the swimmers, and all those guys can almost touch their hands behind their back. If you look at the physique, their arms are longer than they are tall. It's like this hypermobility, your extremities become like rubber bands. You can throw a ball quicker. You can jump higher. You can run faster. People with hypermobility actually have bigger cerebellums and innately bigger amygdalae, which we'll get to in a second. Mm-hmm. And so what that means is if they train that cerebellum, they have higher coordination. They're the tall, lanky person who bounces off all the walls. The other thing about hypermobility is because your tissues are naturally a little stretchier, you tend to get more ptosis or falling of your internal organs, so more gut issues, more prone to autoimmune issues. But your nervous system automatically is ramped up a little bit because it gets more sensory input because of the activation in your connective tissues. About 80% of all the interaction between your nervous system is more afferent coming in than efferent going out. And so that's coming from connective tissue and fascia. So if you're an elite athlete, you're a hunter-gatherer, you're trying to survive in the wild, you need that alertness, that on-edgeness for survival. It's great for a competitive athletics. But if you get an injury, a concussion, multi-building, horrible diet. At least people also as well have, my son's like this. They are Maseratis. You do not put, crappy gas in a Maserati. If you put processed foods, poor quality fats, low protein intake, these people need 1.5 to 2 grams of protein a day just for maintenance of their body. We've had this low protein diet in our culture for the last 20 or 30 years. So all of a sudden, this potential superpower becomes kryptonite. And so all of a sudden now you're seeing these people who would have been elite athletes. It's amazing how many of our dysautonomic POTS pandas, patients, you get to see them ADHD, and the kids' joints go backward and kind of stuff. That is directly associated. Those kids have a 400% increased risk for having this thing. If you've ever heard of it, Dr. Rowe, called neurodivergence, you may never heard that word. You may never heard that word before, right? You're right. It's like, so all of a sudden, okay, if you see neurodivergence, pandas, pans, ADHD, dyslexia, we've had this conversation. I've not read this in the literature. This is my clinical expertise. I consider empaths. I consider empathy empaths, part is neurodivergent because I almost always see in these patients, particularly women, this sixth sense. They have this emotional intelligence that I, with my very concrete mind, can't explain. Um, but you see these things together. So if I see these, like all of a sudden, like, okay, you're hypermobile. Now I'm looking for dysautonomia, which can look like ADHD. It can look like
Absolutely.
it can look like
Anxiety.
well, like it's funny. There, some of the ADHD, clonidine patches for ADHD. It's treating these kids dysautonomia that's expressing like ADHD. So all of a sudden now I'm looking for these neurodivergence, bam, looking for hypermobility, these other things. And all of a sudden now for these patients, I've just connected a bunch of dots that now become leverage points to get their body to self-heal and self-repair. So I think what people don't realize is how your connective tissues connect absolutely everything. If your C1, C2 in your neck is a little loose, you'll get more pressure in your brainstem, which regulates hormones, blood pressure, heart rate, sleep-wake cycles, temperature regulation, immune system. I mean, that's all of our patients, right? With
Yes.
chronic Lyme and mold, and just a little bit of allanto-occipital instability, a little bit of C1, C2 movement can set your patient up for all those things. If
Talk to me about some of the signs for hypermobility, because when I try to
okay.
enter it in the conversation, they're like, no,
Yeah,
no, they're not. I mean, my doctor would have told me. And,
yeah.
we catch it all the time.
So there's a thing called a Baton score that was put together by the EDS Society. Okay, and it's meant to be a research tool. So it's the entry point. You can, as you know, when you have these diagnostic criteria, they're just meant for students to be able to make the diagnosis. Clinicians learn all the nuances, right? But part of that is, can you take your pinky and push it back, behind 90 degrees? Can your thumb touch your wrist? Do your elbows flop back? I'm not hypermobile. Do your knees do that? Can you put your legs straight and put your palms on the ground? Those are like the gross, like, tests for hypermobility. The problem with those is they only prefer the upper extremity versus lower extremity.
Mhm.
So like my son, for example, he can turn like almost 180 degrees around with his back. He's actually had his shoulder kind of semi-dislocate before. I have patients who have their hips kind of dislocate when they roll around bed. Those don't meet criteria, but they have major joint instability. So that's
Mhm.
part of it. But then also it's like when you do a physical exam, this is the reason why in today's tech virtual world, like I need to see people physically, like touching someone's skin. There's this velvety feel to the skin that once you've touched a couple of people with hypermobility, you know what that skin feels like. It has a certain texture to it, elasticity. These people will bruise a little easier. They're injured a little easier. They're more prone to recurrent injuries. And then and I get to that diagnosis so many different ways, but those are the big picture things. In the Bain score has like 3 sections. Section 1 is the hypermobility aspect, the joint aspect. Number 2 is associate things like your arms are longer than you are tall. That's every volleyball player. That's every lot of basketball players. I
Michael
feel like
Phelps, you
that's every
mentioned
swimmer.
swimmers. Michael
Every
Phelps is. Yeah.
that's every swimmer. Like that by itself is associated with an increased risk for mold related illness. So just walking in the room, measuring someone's arms, I can say without any additional testing, you have an increased risk for mold-related illness based on the current literature. There's things like called pisogenic papules, which are when people stand up, they get these little miniature herniations in their heel. You see it all the time. So that's section 2. And section 3 of the EDS Society, which is for EDS, is they don't have like aneurysms or Marfan's or any of the syndromes associated with this. But the thing about this criteria is it's for diagnosing EDS, which is like the worst,
Yes.
which is a small percentage of population, which is uncommon. But hypermobility in the UK, 20% of kids have it there. In the United States, this was a PubMed search I did about a year ago. 12% of college students have it here in the United States. And so all of a sudden it's like this spectrum between I'm just hypermobile and an elite athlete and I'm really smart and quirky and I'm sensory, but I'm gonna be an engineer or a tech person or send rockets to the moon or whatever. There's a big gap between that. And my dysautonomia is so bad I can't get out of bed, and my fatigue is so bad I can't remember what I did yesterday. And oh, by the way, I've got 3 autoimmune diseases and I have chronic pain. There's a big chasm between the two of those. And many people start, just hypermobile and work the way towards that more dysregulated. You saw the dysregulated brain is your thing. This is a whole dysregulated body system. Your body is an extension of your brain. And
Yeah.
if your body is dysregulated and weird, it's eventually going to feed into your brain function. And you see that. That's your jam. That's what you do.
Well, and so many of the kids that I have that have pandas, have this. right? And it's not being picked up. And so when people are listening, and I know they're like, oh my gosh, right? And there are, so my boys, my husband have hypermobility. John Carlo, by far the worst. He used to be able to turn his foot completely around as a baby. It was
Yeah.
disgusting. But he's never had gluten, except when Nona said, I gave him a little crumble, and then he cried for days. So she stopped after that. I don't know why people don't believe, this stuff. So, and he eats super high protein diet. He's naturally gravitates towards it. And we always did OT and PT and all these other things.
Yeah.
So he doesn't have the same impact.
Yeah.
In it, of course, he got as soon as he started to sprout up, he's gotten quite tall. He's taller than me now. He got scoliosis. Right.
Super
So he
common.
has a much more severe case or whatever, but his pain tolerance isn't the same. So he would have like intermuscular tears, which could take down like an adult, and he wouldn't even complain. Right. So he's on the extreme where, Max Pans, he's got the joint laxicity, right? So you may not see it. These are not people that, neither one of my kids, it's not like they're floppy or they are not coordinated and all those other things. We're, as you mentioned, elite athletes. So it's outside of people's minds. So as people are thinking about this and talking about, you talked about so nicely some of the clinical symptoms. If people have this, what should be their steps in supporting their brain and body?
Yeah. So some basic things is you just got to eat high calorie food, not calorie, high quality food. And so first you need like real high quality protein. People forget that, before World War II, 30% of meat consumption in the United States was organ meat. Organ meat is
Mhm.
rich in trace minerals. It's rich in B vitamins. Of course, it's protein, and it's rich in phospholipids, which are, phosphatidylcholine is the most common phospholipid in our body. It's important for biofilms, cell membranes, and nerve wrappings. So biofilms comes into chronic infections. Nerve wrappings comes in a lot of these neuroinflammatory conditions. So just getting the right kind of food and then supplementing with clean sources of phosphatidylcholine. Lots of trace minerals. 80% of Americans have a magnesium deficiency, and depending on what you read, maybe 90 to 100% have a potassium deficiency. In order to make good connective tissues, you have to have trace minerals, or just regular minerals, trace minerals, and rare earth minerals. Vets know about this. We have a farm, and I've actually learned some stuff from having animals. We raise our own cows, and it's common knowledge in the veterinary world that there's about 96 trace minerals that ruminators get from eating grass. You feed them grain only has about 62 or 63 of these minerals. So cows or animals or goats that are only fed grain develop diseases of mineral deficiencies. And hypermobile people, that's you need all these rare earth minerals. So all of a sudden, mineral water, clean water, the right kind of food, not eating processed grains, not eating processed anything. We talked about before when I was talking to you, just real food, real organic, clean,
Yeah.
biodynamic, whatever you want to call it. So that's like the starting point. And then it's
And
like,
that's hard for people. Like, people really struggle with that. And, I want to honor people that have kids with ARFID and, sensory things. But what I want to say, because I have, I always talk about my mom that had, 3 autistics and another with 5, if they can do it, I feel like anybody can. And
yeah.
when the body gets more of the nutrients, the resistance goes down to those foods. It's that part of getting it to happen, and you gotta, dip your toe in, you don't jump into the deep end, you move through it. But nutrients are critical, and there is no working around that.
Yeah. The thing about it is that having deficiencies in trace minerals, zinc, molybdenum, strontium, rare earth minerals, increases your risk for infections. So if you're dealing with chronic infections, and a lot of these people with hypermobile have respiratory tract issues, asthma, allergies, eczema, skin issues, gut problems, like people don't realize the connection. Like your diet is setting you up for the leaky gut that's giving you the skin problems. Your gut won't heal. We give people glutamine. I'm like, great, that's awesome. You need a ton of amino acids in general. And if you do an organic acid test on these people, your painless pans people, what do you see on these people? All their amino acids are low, right?
Yes.
if so you're shaking your head. So you're like, okay. And I'll see that. If I see that organic acid test, my first question is, are you starving yourself? Are you fasting? Which is usually not the case.
Right.
Are you hypermobile? Because all of a sudden now you have a harder time, you need more, and you also have a harder time absorbing nutrients. These people tend to get more SIBO, which can be related with B vitamin deficiencies. So how many of your kids, you check them and their B1, B2, B12 levels, folic acid levels are low, right?
Low.
Yeah. And so all of a sudden now you see that it's the link that makes all these seemingly unrelated things connect. And
Yeah.
so
And so many people go to, with my Pans and Pandas family, like, I'm going to do IVIG. I'm going to do plasmapheresis. I'm going to do all these things. And maybe they improve, but they're not really addressing those other components,
yeah,
which get them in a flare cycle where they're just
yeah,
back and forth, back and forth,
yeah.
back and forth.
Yeah, the plasmapheresis, the IVIGG or the EBU or whatever therapy they're doing, that's like the big reset. That's all someone, you can get your kid out of flares and get the kid out of the hospital. It can prevent, whole complete psychosis or whatever. But if that's all you do and you don't address the foundational stuff, this could happen again in 1 or 2 or 3 years. So that's the first thing, is a diet. The second thing is the environment. All these kids are sensitive to environmental chemicals, toxins, and mold, water damaged buildings. And so all of a sudden, that's a whole different pathway to look at. Um, and the one thing I want to drop here is the whole empath thing that I see all the time. Is it's another superpower that becomes kryptonite. If you're an empath, you can read the room, you can read people, this is a good person, this is a bad person, this person's dishonest. You have this. One of my patients actually works at the Federal Reserve, and she's like, I can tell when bad people are there. And my boss is like, you're crazy. What are you talking about? And a year later, they're caught doing fraud or whatever. And the boss is like, how'd you know? She's like, they made me, I got a sick feeling in my belly. I just knew there's something off with them. You take that emotional intelligence that, you might refer to as clairvoyance. I just record just that empathy, not empathy, but that empathic ability. And you traumatize that young girl. She has physical, sexual, emotional abuse. She made it through COVID. Whatever it is, you get a concussion or brain injury. All of a sudden now, that hyper alert nervous system that can sense these things gets jacked up, and now you react to everything. You're hyper reactive. Your startle response is off the chain. You have a hard time sleeping. There's a thing called an adrenal pupil, which you've seen it with these kids, where the eyes are big.
Totally.
Yeah, you shine light in their eye, and it gets small, right? So the openness is in the dark room is more of a sympathetic response, right? You shine light into it, and the parasympathetic nervous system constricts them down. But because they're in this low grade trauma state, because of this, their body forces the eyes back, and you'll see the eyes undulate. That is a dysregulated nervous system. And if you want this, and this is your thing, if your nervous system is dysregulated, then all of a sudden your gut won't heal, you won't get quality sleep, your immune system will be imbalanced towards a Th2, which is more allergy, asthma stuff. And all of a sudden now that whole brain body thing in these hypermobile patients with whatever becomes a bigger deal. And so trauma, emotional balance, like it's made the way I look at patients, like, as you can see, the buffet of things is massive now. It's not just treating the leaky gut, not just removing
No.
mold. It's this whole massive entourage of things that you have to deal with. If you don't deal with them, these patients get stuck, and their body doesn't self-heal and self-repair like it's supposed to.
It's about balance, right? I think we get people in all different levels, right? That we're getting people in crisis. We're getting people who are like, I'm stuck at 60 or 70%. I've done all these things. I've seen these famous people. I've tried this, whatever. And what I've learned, right, when you're getting in that inflammatory response, when you're not addressing the nutrient deficiencies, and of course, when you're not getting your nervous system to regulate, which is a constant thing. It is an everyday thing. You must tend to that physical and mental garden. And, I've said this before that, typically this one person in the family, drives this, just like Anna did for you all, like it drives this, I'm changing for the whole
Yeah.
family. And the whole family does benefit from these terrible, terrible things that happen to yourself or to your
Yeah.
child. But it is a lifestyle component, right? And
Yeah.
it can feel very overwhelming for people. Like, oh my gosh, now he's telling me I've got to make sure I've got all my trace minerals and, I've got all this stuff. But instead of thinking like that, right, it's about empowerment to the solutions, and that you do have a lot more in your control than you think.
Yeah, I want to see people like kind of write out the whole buffet of things, right? Which sometimes is, 1 or 2 pages of things going on. It's like, let's just pick three. And the foundations, the foundations. You never want to ignore the main thing. You want to keep the main thing, the main thing. And that's, you know, gut health, what's going in your body, you know, stress and sleep. I've actually coined the term the triangle of health. I'm actually creating a whole educational platform, patient-based platform around this concept. Like the three major areas where people's body's ability to self-heal and self-repair gets blocked are these three things. And so you can take the most fancy supplement and do all the cool things and see the fancy people across the country. But if your gut's a wreck, you're not eating real food, you're not addressing the gut health. If you're getting poor quality sleep, you're not getting to bed on time. You're not getting restorative sleep. You have dysautonomia and you wake up throughout the night, right? Right awake after a couple hours. Or you've got this kind of trauma response. Your body's going to get stuck. And I think one of the things people don't realize with the whole trauma thing is there's like big T trauma and little T trauma.
That's
Big
right.
T, big T trauma is like, people forget that PTSD was not a thing till Vietnam War. It was not a thing. You considered a weak soldier. If you had an issue during World War I, you considered weak. It wasn't until the 70s that we said, hey, this is this thing called PTSD, but it's only for military people, right? And now we've realized that PTSD could be, being married to a narcissistic spouse.
Mm-hmm.
Over years, it's like the drip, drip, drip water torture that can literally make your brain go insane, dysregulated. But there's also the physical, sexual, emotional abuse. But I think the thing we ignore is the little T trauma of daily stressors, of taking care of someone.
How about
kids,
having a pants kit,
mama
or
kids with special needs, or
yeah,
someone, either someone caring for someone with Alzheimer's or someone caring with
yes,
someone with autism. Like these daily stressors, it's really interesting. There's an association, increased incidence of Alzheimer's and the caregivers of Alzheimer patients because of that increased stress for those years. And so part of what I do and part of what you do as well is like figuring out, is there a low level stressor that you're
mhm.
ignoring, that's being overlooked, that you're
There
minimizing?
almost always is, right, Dr. Aaron?
Yes, there's something that's being
Yeah,
missed.
yeah. I mean, I rarely meet people. Yes, I have people with, stress activated nervous system, toxic trauma, whatever, there's something. But most of my people have little T's,
Yeah,
little T traumas that are causing that activation to stay stuck, right? The good news is there's lots of things to do to get them
absolutely.
unstuck. But I do find it to just be a linchpin in
Yeah,
healing the body. And I know we're all looking for the thing, we're looking for the pill, we're looking for
yeah,
this, but that's just not what's happening in the world, right? There's so much of a change and
yeah.
complexity in medicine, right?
Yeah, I mean, we always taught in medical school to look for the Occam's razor, look for the simplest thing that explains everything. In a world where infectious disease was the most common cause of heart disease in 1900, for example, in a world where pneumonia would kill you before you're 60 or 70, or kids would die in childbirth, so we had to wash our hands and create better surgical procedures, like that mentality of like the one size fits all, the one thing. But we're switching to this chronic disease model where you just don't have a diabetic or hypertensive or an obese person or a
That's right.
ADHD. It's all these things together, and so complexity is the new normal with
It
these patients.
is, it is. And, you and I both mentioned mold earlier, and people are now having an awareness about mold and how it is a contributor to so many mental health and physical
Yep.
problems. I mean, I can't be in any of these groups without people talking about mold, parent groups.
Yep.
Talk to us a little bit about mold. It's a huge conversation.
Yep.
I definitely need you to come back and talk just about
Yep.
mold because people don't understand it. They
Yep.
don't understand how it impacts. They also don't know what to do once they
Yeah.
realize mold is I often find it to be not the thing, but the thing that is the nail in the coffin. And when you
Yeah.
already have other things going on.
Yeah.
But talk to us a little bit about mold and how it's, how it can impact people's health.
Yeah. So I actually have done my channel like about 6 or 7 videos on mold, walking through. Myself and the doctor works with me, Dr. Jensky, talking about this topic, and I've done a blog series on as well, just as resources to go more in depth on that. But the basic gist with 110,000 foot whatever is that I think it was 1998. Dr. Richie Shoemaker first described the first case of chronic inflammatory response syndrome. And it wasn't mold. It was actually Pfiesteria. It was this algae-like stuff in Maryland that watermen were getting exposed to. And from there, it went out and expanded to like water damaged buildings, which include mold. And now we realize that things like breast implants, vaccine-related illness, realize things like concussions. There are a whole lot of different causes for this thing called chronic inflammatory response syndrome. I think mold is just percolated to the top because it's more popular. People kind of get it. So the thing I tell people about mold's a big, big deal, but it's a small part of chronic inflammatory response syndrome. 80% of chronic inflammatory response syndrome is from water damaged buildings. Okay. So 20% is scorpion bites, is recluse spider bites, is concussion, is there's actually an overexertion, overtraining syndrome, post-Lyme syndrome. You get a tick bite, a lot of people who don't heal, they develop, it's called CRSPLS, so it's chronic inflammatory response syndrome, post-Lyme syndrome. So it's that 20%. There's the 80%, right? And that is water damage building. Within that 80% of that is two things: actinomyces and endotoxins. So mold proper, is basically, 16, 18% of the entirety. So if you talk about a water damaged building, actinomyces is a soil-based organism that usually grows in crawl spaces. It can actually colonize other places in your house. And then endotoxins are a bacteria that grows in moist environments. Well, endotoxins also grow in your gut, gram-negative bacteria.
Mhm.
All of a sudden, there's these connections between your gut health and endotoxins with chronic inflammatory response syndrome, mold stuff, and even the environment. When I was doing my training with Dr. Shoemaker, one of the rabbit trails he led me on, I asked, when I asked him questions, his response always was, do a PubMed search on this, was his answer to questions, which was a little annoying, but it led me down this pathway of, in Europe, they do a lot of research on endotoxins in the environment related to industries. And that was a trigger for me with a lot of my patients from up north, industrial centers, major
Yes.
population centers, black carbon. Like, there's a lot of literature on that environment being an endotoxin burden to people. Could this be a part of this bigger thing? And so mold is super popular. I'd love to talk more about mold, but I always like to start with this big picture. It's like, if you're just a mold expert, it's like just being like, you're just a pandas expert. I'm like, can you be just a pandas expert if you don't do tick-borne illnesses and you don't do mold and you don't do concussions? Like, you really
No.
have to do the entirety of it. So that's like the way I want to start the conversation. Like, I do mold all day long. I'm a mold expert, blah, blah, blah. But it's really, the appropriate term is chronic inflammatory response syndrome, which includes water damaged buildings, which includes mold.
Yeah. What do people do when they've been told, like, we should look at mold? What steps should people take? Because this is really where I think, gosh, people are getting the mold dog and they're trying to find somebody to look at their mold, and it's confusing and it's expensive, and then they don't know what to do. And then, what steps should people take at a very basic level?
I mean, well, there's a thing called a cluster analysis, which is a questionnaire. It's actually on my blog series, and it walks you through 13 different categories of symptoms. And if you have one symptom in 8 of those 13, you actually have a 95% chance, based on the research, of having chronic inflammatory response syndrome. So I think that's good enough for me. But the case best definition is 3 levels. The next level is failing a VCS, which is a visual contrast test, and then lab testing. Okay, and lab testing is a little hard to get a hold of, but just those 2 get you to 99% certainty. But if you think you have this, it's not just an issue with getting that diagnosis. In general, your environment can impact your health. I've had patients who came to me. I've got this one guy, he actually had multiple strokes and had been to Mayo and told he had this autoimmune brain thing with strokes. Come to find out it was mold. Had another patient who had this thing called toxoplasmosis cardiomyopathy. It's in females postmenopausal. It's a stress-induced heart failure. That was her diagnosis at the university. Came to find out she had mold-related issues. So unfortunately, there's a lot of disconnects with, typical, even certain cancers. One of the people in my training, Mary Ackley, actually is a psychiatrist in Maryland. Now she got down this world. She was seeing people with psychosis and bipolar and schizophrenia, who she would actually start dealing with mold stuff, and their schizophrenia would go away. And she started realizing, wait a second, the brain inflammation of something as crazy and genetic as schizophrenia actually can have a mold component. So it's one of those things, if you're going down that pathway, the first thing you want to do is find out do you have some of the basic symptoms that we all can agree on, which you can go down blog series talks about that.
I'm gonna put the blog in the. I'm gonna put the series in the notes.
Okay. Oh, cool. And then is your current environment an issue? Because I've seen patients who had a mold exposure in college and then they didn't get the triggering event, which for this, could be a tick bite, could be a concussion till 5 or 10 years later. But because they have this gene that makes it difficult to detoxify the mold, they couldn't get it out of their system, right? Or the water,
That's right.
the water damage stuff. So just check your house. I mean, how much do people spend on filters and food and supplements? Here in the Richmond area, you can get your house checked for, $1,200-$1,400, which I know is an investment, but if where your kids sleep every night, if where you and your spouse sleep every night, if where you spend most of your time isn't clean, and again, it's not just mold, it's the actinomyces, it's endotoxins, what kind of cleaning, do you have carpet in your house? There's a thing called PAH, polycyclic aromatic hydrocarbons. The number one source is indoor smoking. The number two source is burning incense. The number three source is your carpet. So I think everybody now agrees that indoor smoking is bad. Many people don't realize burning incense and don't do it, but you're just having carpet gives you this chemical that now can attach. And from Dr. Yehuda Schoenfeld's work, he's a Israeli immunologist that described the syndrome that looks a lot like mold. And he realized that adjuvants are things that activate your immune system, including chemicals, metals like in vaccines, as well as petroleum products, can give you this brain inflammatory kind of thing. So just checking your house to make sure your house is clean. So to summarize, get this, would you have the symptoms? Is your house clean? Nice start there. And if your house is dirty, fix it. If you have the symptoms, the treatment basics is easy. Remove exposure and detox. Remove exposure, detox. And there's binders and cholestyramine and lipid therapy and a bunch of things I talk about in the series. But the actual treatment is basic. Get out of the situation if there's current and work on detox. Now, obviously there's layers to that, and there's layers.
Yeah, it's hard.
Issues. Yeah. But I've had patients who literally just, one young lady started working with me. She was doing our connected health thing that we're working on right now. And she did that, just signed up for our community thing, started looking at it, and realized, and she was going to come and see me because she had some fertility issues and PCOS and stuff like that. She realized she had mold in her house. By the time she got to see me, she'd already fixed her house, dealt with that stuff, and was already feeling better. Ended up getting pregnant, a year later. Did really, really well, but it was literally just the knowledge of what I need to do and how to do it was crazy empowering for her to actually get better.
It's mind-blowing to people to think that mold, we kind of like, oh, everybody's got, mold, but there are a lot of reasons that, mold is dangerous, and we can have genetic issues with clearing the mold. And I think people are really getting very aware of it. I mean, as we talked about, neuroinflammation is a big part of why people are having physical and mental health problems. And you've spoken to me about this before, and I know Schumacher talks a lot about this. So a lot of my people with pandas, they do better by the ocean. Can you give an explainer as to what happens near the ocean in the cleansing, I'm simplifying, of the cleansing of the air, and why a lot of people do better with mold sensitivity?
And this is, it comes down to me reading textbooks on building biology and how to build things. And so at the ocean, the first thing about the ocean is you don't have a lot of these endotoxins in the air. Okay. Like I live in Richmond, so it's a moldy area. It's a swamp. There's a lot of endotoxins in there just to begin with. At the ocean, it's like salt water, like from your environment doesn't have that. The second thing that's interesting about the ocean is you always have wind, right? And so the way a house works is if you have a constant wind coming towards you, or because basically the ocean, as it heats up, the wind goes one way, the other way, you actually infiltrate the building's air cavity. When you have wind, there's no way to stop it from getting in your house. Okay. So what happens is even if you have a beach house that had tornado damage, and this kind of led me down this pathway, like how can you have a house at the beach that had a tornado damage or not tornado, but hurricane damage, water damage, and you still feel better in that? It's this phenomena of the air is clean, but there's also external force of the air hitting your house, and it creates like a airplane wing. One side has a positive pressure, the other side has negative pressure. And what happens, you have tons of infiltration of the outdoor ocean air into the house. The only place that happens is where land comes to the sea. You don't have high or mountaintops. You don't typically have that degree of wind, and so it actually forces this clean, low endotoxin air into your house. All of a sudden, even if you have carpet and mold in the corner, which to be honest with you, every beach house I've been to has had mold in it somewhere. And that's what made me think, like, what is this phenomenon going on where I see the condensation and I see the vent, because I always check these things out. Like, how is this possible? And as I started looking into the actual physics of it, I realized it was the external environment, low endotoxin, winds, actually can abate to a certain degree the indoor toxins and stuff. And so you only get that at the ocean. And so I have that, I have patients who it's the exact same thing, who go, I feel great at the ocean and they feel amazing out there. And you talk about the houses and, oh yeah, it has a musty smell, but you open the windows up, it's gone. It's like, it's because of that external environment with the wind. And that's also helped inform me of how I have people take care of their homes wherever they're at,
Yeah.
if they have mold
So
issues.
helpful because it literally comes up constantly. I have a family with me right now. They had to leave where they live. They came from California near the ocean. They moved to Texas. They got real sick. They had to
Yeah.
leave and now they're back to
But one
California.
thing,
And they just their kids don't have the same problems when they're, near the ocean.
but one thing that's interesting, people like, I'm gonna go to Arizona, I'm gonna go to the desert and I'll get better. It's like, no, 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 no. Because those places that are super hot, Texas is one of those.
Yeah,
What never turns off? Your air conditioning.
totally.
And so I've been, there's some group we're involved with that we were talking about before that's in
Yeah.
Arizona. And every place I've been and stayed out there, whether it's in Southern California in the Palm Springs area, they've all been moldy
Yeah.
because the air conditioning units are on 24/7, 365. And so you really need to go to altitude, which is more like some places in Utah and Colorado where the air is naturally dry. And the outdoor environment is such that every night in the summertime, it's cool enough. You can open your windows, get
Mhm.
fresh air every evening. The relative humidity outside is like 20%, 20, 30%. Those environments, you're not going to get condensation and wall cavities. And this is something else that happens in a building is we have outdoor cool air coming inside, infiltrating into a warmer space. You'll get condensation in the wall cavities.
That's right.
Yeah, if the outdoor relative humidity is 20%, that phenomenon is much, much
Oh my
less
God.
likely. So like either at altitude or at the ocean, enable the environment to overpower the deficits of modern building structures.
So fascinating. We could talk about it all day. I know you have this program because not everybody can work one-on-one to you because you're not accepting new patients. And I know people are going to contact you because you really are amazing on a lot of levels, not just as a physician, but as a human being and a dad. But talk about your program that you created for people because I think everyone is out there searching and Googling. It's like
Yeah.
why people work in my dysregulation solution and they're looking for support from a trusted expert. And you can trust Dr. Hartman and his team. Talk a little bit about what it does and how it can help people.
So one of my underlying premises is that your body was made for health. You were made for health. Um, if you can just find the roadblocks that are blocking your body's ability to heal, if you can just give your body what's lacking or remove what's in excess, then your body's going to do what it was made to do. It'll self-heal and self-repair. I mean, we get that. That's one of the reasons why kids heal so well versus, older individuals and stuff. And so, but I found out those blockages that I mentioned, there's three major blockages, gut health, stress, and sleep. These are the three areas that people have the hardest time. What is real food? You mentioned how hard that is. How can I work on a gut issues with inflammation? Sleep. It's, the average American now sleeps 6.5 hours at night. In the 1800s, the average American slept 8.5 hours a night. We are literally, as a country, sleeping 2 hours less than we did 150 years ago. And the quality of sleep we're getting is less because of eating before you go to bed, alcohol consumption. Looking at a screen before you go to bed dysregulates your brain and affects your quality of sleep. And then stress. If one of those things is off, it's going to block your body's ability to heal and self-repair. So what I realized is you can figure this stuff out with the right guide, the right information, the right community, anywhere in the country, anywhere that speaks English, because that's what I speak. Well, now with AI, you can probably translate it too. So we put together Connected Health, which is kind of a way that connects the dots for people. It walks people through this whole process of, what's wrong with your body, taking some tests, and then it has these little out pockets that actually guide people through their own healing process. And what we've done is created the system that, based on how you answer the question, it says you're a gut person, you're a stress person, you're a sleep person, you've got more hormone issues, and actually allows people to tailor what they're doing based on what's going on. And the unique thing about it is after you go through the ecosystem once, which is about 12 to 16 weeks, depending on how quickly you go through it. Then you retest. And this is the layers we see all the time. You come in and first it's mold in the environment, change the environment. Now it's a gut problem. Now it's a stress issue. Now, this actually allows you to go back and reevaluate yourself and say, now what system is off? And that's
What's
all.
next?
Yeah. What's next? If you're a gut person, great, deal with your gut, but now you got adrenal depression, you got hormone problems, you got sleep. And so it allows people to actually wash and repeat, but because it's individualized through the way we set the testing up, it allows you to figure out what's next for you. And we do this in the confines of a community with a coach. So then all of a sudden now it's not just you learning from us, it's you learning from a community of people walking through the same thing with you, with the coach supervising you. And then once a month, I'll hop in and answer questions and stuff. So it's like, actually, I'm going to make it available to my current patients because I feel like it would accelerate their healing as well. It's all the things I want to do with patients I can't do in the office, right?
Right.
Yeah, it's basically I'm trying to create that world where all the things I want to do with you in the office I can't because I'm too busy answering lab questions and stuff. Like, this is your thing. And the reality is 80% of people can probably get better if they can find their core things with their biology that are off and their environment that
And
are
they
off. And
just
so,
need proper guidance. And I
yeah.
can't say enough about community. I'm a social girl and I crave community. And I also think when you're doing this path, the people around you,
Mhm.
most people start the journey and you just don't have enough support. And so when you
Right.
have the right community, you feel safe to ask questions, you also feel safe to celebrate things, and they're your tribe.
Yeah.
And I just can't nobody thinks they need a community, but actually that is
Yeah.
one of the greatest things we need,
Yeah. It took,
especially as we're disconnecting
yeah.
as a society.
Yeah, with my wife, it took my wife about 5 years of researching things on her own, figuring out stuff to actually get her energy, get her life back. It took her 5 years.
Mhm.
You know, um, if she had had access to something like this, she could have probably figured it out in 6 months.
Yeah.
And so so you have to be self-motivated. You have to be someone who's willing to do the hard work. But if you are, then all of a sudden I look at it as an accelerant, you know, it speeds up the process. And I'm looking for people like my wife, individuals like her who know they have an issue, but they don't know where to go. How can this speed up their healing process and give them the resources they need? And that's kind of was my goal, and that's been my passion to put that together for the last couple of years. And we've been working on it for
I know you guys
a
have been
couple of years.
working on it as long as I've been working on mine, so because we're high level. There's nothing but amazing. Like, we don't want to do anything else, So this has been such an important conversation. I know this is going to create a lot of questions, and I put this up and I'm going to have it in the notes, but you can reach Dr. Aaron Hartman at Richmond Functional Medicine, all one word.com. Again, it will be in the notes. And I just have to say thank you from the bottom of my heart for your work and your commitment. And I hope that when people listen to this, I have a lot of professionals that listen to my show, and I hope it becomes inspirational for themselves, because functional work is really important. And definitely please share this with your pediatrician. Share this with somebody that needs to hear this. And, thank you so much, Dr. Hartman. Always a pleasure.
Dr. Rose, great to see you again. Always a pleasure. And thank you so much for inviting me on to your show.
Oh, fantastic.